When we look at healthcare, there are two approaches to it. Some people prefer to put out the actual fire that's burning. They address the actual underlying problem. Most people address the alarm. They turn off the signal and ignore the problem until it gets bigger and bigger. I'm Dr. Jeff Cumro. Over the past 15 years, I've worked with over 5,000 patients. And through that, I've seen patterns. And how you approach your health is how you approach your health. There's no judgment in this video. What we're going to look at today is the two different types of approaches to healthcare. And I can tell you without digging up any statistics or anything like that, that most people are the type that just turn off the alarm. And I don't that's something that it doesn't it frustrates me at times as a practitioner because there are so many things that we can do to help people move forward. There are so many things that we can do to improve their lives and actually address a bigger underlying problem. But people have to want to make that change, right? People have to understand that that is the case. And that's something I'm always working on communication to try and do a better job of getting people to understand where they actually stand in their health, what type of questions they need to ask themselves, what kind of questions they need to ask their providers, and how to move themselves forward. And the reason that I know that most people are not addressing the underlying problem is 80% of the healthcare issues that we face, the chronic diseases that we face, are lifestyle changes, right? They're things that we ultimately lead ourselves towards through the choices that we make in our lifestyles, whether that's eating poor diets, whether that's not exercising enough, not sleeping enough, smoking cigarettes or other tobacco products, different things like that. When we actually look at the underlying things, 80% of those can be healed or prevented through lifestyle measures. So by improving your diet, by stopping smoking, by stopping drinking, by exercising more, by doing all of these different things, 80% of our problems would disappear. That's incredible, right? So I know that most people address the alarm. And the analogy for this is if you walk into a fire in your house, do you actually get the fire extinguisher and do you put the fire out, or do you just turn off the alarm and pretend that it's not there? What happens if you do that? The fire continues to burn. It continues to get bigger. It becomes a bigger and bigger problem. And this may look like, somebody who has a pain and they ignore that pain and it becomes a bigger pain, a bigger area like the whole lower back, or, the headaches go into the eyes or different things like this. Ignoring that over time, it doesn't just become more of the same. It can become more of other things. As you start to move differently with that lower back, it leads to degeneration of the hips, or it leads to degeneration of the knees, or it starts to lead to, a decrease in your ability to do exercise, and that leads to heart problems or whatever this may be. There's a million different scenarios for every different thing here. But when we don't address the actual underlying problem, it can lead to massive things that don't even seem like they're related, right? Heart disease doesn't seem like it would be related to lower back pain. But if that lower back pain increases the stress on your system, if it decreases your ability to sleep, if it decreases your ability to actually move around, that's an important thing to know, right? And that's where getting to the actual root of the problem is more important. And we've become a society that relies a lot on medication. And I'm not saying that medication is the wrong approach, right? Because medication can be a very, very valuable tool in some of this. However, when we just work with medications and we cover up that symptom, it doesn't do anything to actually change the biomechanics. It doesn't change how you move. It doesn't change how you function. It doesn't change the coordination and timing of those muscles to give you the stability that you need. And we need all of those things to continue to move ourselves forward. And this goes for more than just pain. If you look at gut function, a lot of people suffer with, diarrhea or constipation or different things like that. They don't think anything of it, but those things can be signals that, you have a leaky gut, that you have, autoimmunity getting started, that you have, pancreatic cancer getting started, different things like this. All of these things are signals. And when we ignore the signals and we just make our lives easier by covering them up, it doesn't address the underlying problem. So that's the question I want you to ask yourself. Are you covering up a problem that is going to be bigger? What do we need to do? What kind of action do we need to take? First of all, we have to understand what kind of things are associated. So getting an appointment and having a discussion with your practitioners. What should you ask? What should you do? Like, what questions should you be looking at to get this to the root level? Because when we get to that root level, we know what we have to do. And when we know what we have to do, life gets so much easier. So if you have questions on this, by all means, reach out to me through any of the normal mechanisms. And I know that your time and your attention are two of your biggest factors. You know, they're the things that are most valuable to you. I appreciate you spending some of that with me, and I'll catch you on next week's video.